We are live, Doc.
Good afternoon, everyone, and welcome to one of the many public webinar informative series courtesy of the South African Dental Association. This afternoon, I will be your host, Dr. Sudhir, Rathiram, as you can see on the screen. I'm a dentist in private practice based in the warm, cozy shores of KwaZulu-Natal, and I hold 2 degrees in the discipline of dentistry, as well as being a senior member of the South African Dental Association. And then joining us this afternoon, we have a welcome treat of Dr. Rajeshree Moodley, who is a senior lecturer in the School of Dental Therapy and Oral Hygiene in the University of KwaZulu-Natal. She lectures and supervises in the field of operative dentistry, dental materials, caryology, and dental specialities. Dr. Moodley also holds a PhD in the field of dental education and occupational health and is actively involved in research, publishing in local and international journals. In addition, she has presented papers at the local and international conferences, and Dr. Rajeshree Moodley also supervises postgraduate masters and PhD students at UKZN. Her research interests are in dental education, occupational health, and public health, and she is currently also the UKZN representative on the IADR South African division. Welcome, Dr. Moodley,
Hello,
and thank
Dr.
you for joining
Rathiram.
us for tonight's
Thank
webinar.
you for the warm introduction.
Super. All right. So, guys, this afternoon's webinar is based on dental amalgam restorations. So, I feel a good way to start off the topic is to understand what is dental amalgam composed of. So, primarily, dental amalgam is composed of an amalgamation of copper, zinc, tin, and mercury, which forms as the binding agent. But a lot of the times, what we tend to hear when patients come enter our doors is, Doc, I would like this silver filling removed, or would like this lead filling done. Dr. Murli, could you elaborate a bit further on that misconception?
Okay, so a lot of times patients will come into the practice and they've heard from the media that dental silver fillings are bad for them. It can be neurotoxic or it can harm their kidneys, harm little children. So they're nervous and they want it removed. And we need to assure the public that if they have a restoration for 20 years and it's sound, there is no need to remove it. But then if you believe that something is causing harm and you want it removed, you can consult with your dentist or your dental therapist, have a discussion around it, look at the health of the restoration before you make such a decision.
Thank you. That's quite interesting, Dr. Murli. And I think flowing on to the next aspect regarding dental amalgam fillings is to actually understand what was the true indication for these restorations and a little bit of history. Dental amalgam fillings have been in dental practices since as the early period as in 1830s and to current date. So what we found is that during that period, there was a need for restorative material that was rather biostable. And one of the characteristics of dental amalgam fillings were that they could effectively restore large carious lesions, largely fractured teeth, as we can see on our photos on the next slide. And that was perceived as one of the indications and benefits of dental amalgam as being a filling restoration. But as time has gone on and as technology has improved, the same advances have occurred in the discipline of dentistry. And now we find that there are many other alternatives to dental amalgam that fully covers the perceived benefits of an amalgam restoration. However, a lot of individuals are concerned about certain aspects regarding dental amalgam. And one of them being, as we earlier mentioned, one of the ingredients in dental amalgam being mercury. So a lot of individuals Many dentists as well as patients are very much concerned about the perceived toxicity of the mercury found in the dental amalgam fillings. Dr. Moodley, I'm sure you'd like to come in here and just elaborate a bit on the perceived toxic effects of mercury contained in dental amalgam.
Okay, so dental amalgam has mercury, and mercury is branded as a product that is bad for you. So if you look at mercury, there is different types of mercury. There's elemental mercury and there's methyl mercury. So what happens is when we burn coal in the seas, in the water, in seawater, there is mercury, the methyl mercury. And this is also there because of our waste products that we put into the sea. So what happens is the fish eats this products, and then the bigger fish eats the little fish. So our big game fish right now has a high mercury content in it. So that is why we tell pregnant women not to eat tuna, not to eat these big game fish because of its mercury content. So mercury will affect the fetus. And at that stage, it is a problem. So that is why we tell pregnant women not to have tuna when they through the gestation period, through the pregnancy period. So what we need to do is be aware that mercury affects the fetus. So if there's a pregnant woman on the chair, or if you are pregnant, an amalgam restoration should not be done. So remember, that's where it's a problem. Mercury becomes a problem when a dentist or a therapist is removing the restoration. So they can protect you by using a special, it's called a rubber dam, which blocks any mercury or any products or any metals from getting into your throat. So a dentist will remove an amalgam like that in a dental practice. So the only time an amalgam restoration that contains mercury becomes a problem is when the dentist is removing it. And it is done in a condition where you are protected. So a dental therapist or a dentist, when they're removing your silver filling that has a bit of mercury in it, will protect you by putting a rubber dam. So if you have silver fillings in your mouth with mercury, it's not going to pose a problem unless it's cracked or damaged and you have to remove it. And that's when there's a bit of mercury leaching out. I hope that helps.
Thank you, Dr. Moodley. That's quite reassuring, I'm sure, to the general public as well, is that you don't need to now wake up and if you got the amalgam fillings in your mouth, go to your dentist and tomorrow morning say, Doc, please remove these fillings. I want all the mercury out of my system. Um,
To
the
add,
restoration only becomes
to add,
a bit of a risk when it's when the dentist is removing, but together with the use of rubber dam and high volume suction, you will be in a safe environment. Yes, Dr. Moodley?
Dr. Rathiram, we need to tell the public that instead of filling their teeth, they should think about preserving their teeth. They should think about preventing oral health problems, preventing caries, preventing gum disease. So that should be their mantra. So the people out there should learn that we should take care of our teeth, prevent fillings, prevent gum disease, so we don't have to have fillings done. So that's what we should drive towards, saving our teeth. That should be the most important.
Most certainly, Dr. Moodley. I think all our fellow colleagues as well in their practices reinforce that prevention is the ultimate goal. Most certainly, your natural tooth structure is meant to last you as long as you take good care of it. Some of the other disadvantages with your dental amalgam restorations, unfortunately, is that when a tooth is restored with an amalgam filling, it tends to discolor over time. And those also due to also the setting process when the amalgam restoration is placed. As well as if we have to understand that amalgam, as I previously mentioned, is composed primarily of metal element particles. They tend to expand and contract at a greater degree than that of your tooth. To give an example, if you take a glass and you fill some hot water in the glass and you immediately pour that water out and you pour in some cold water, you might find a few cracks in the glass. So you can just imagine the differing temperatures that enter our mouths on a daily basis, especially during the winter period. So unfortunately, one of the risks with the dental amalgam restoration is that it has a greater degree of contraction and expansion, which can result in unfortunate circumstances where the restoration or the tooth that surrounds the restoration may fracture. And also, one of the issues with dental amalgam restorations was that when an amalgam is placed onto a cleaned out cavity, that the patient might find a degree of sensitivity thereafter. And how they choose to mitigate that issue is that the dentist would place a form of a liner or a base underneath that amalgam restoration, which you could perceive it as a degree of cushioning to just ease off that sensitivity. Now, Dr. Moodley, what I'd like our viewers to also be informed about is where is the world going regarding amalgam restorations? What does the World Health Organization's opinion regarding amalgam restorations?
Okay, thank you for that. In 2013, there was a convention referred to as the Minamata Convention, and this was held to actually protect the environment and our health from mercury and its effects. So post Minamata, it was decided that there will be a phase down approach with the use of mercury and in dentistry, dental amalgams. So all countries were asked to phase down, drop the number of amalgam restorations done, and slowly lead to phasing out dental amalgam for the reason that it affected our environment. So it got into the water system, then into the ocean, affected fish, affected aquatic life, the marine kelp and all the marine animals. So that was a problem. And the environment and protecting the environment was the main focus of the Minamata Convention. Subsequently, the WHO also said we should maintain a phase down approach and then work towards a phase out approach. They did not say do not use amalgams as a restoration material. They supported that we use it until we find the best replacement material for this. So the International Association of Dental Research also supports the phase down approach, leading to the phase out approach. And even in South Africa, we are phasing down the use of dental amalgam until we can phase out completely. It is a material that is much cheaper than other materials that are available. So the low and middle income countries are still using dental amalgam. I hope that answers your question.
Thank you for that, Dr. Moodley. That's rather informative and rather clear as well. Flowing onto the next aspect that we're going to speak of now is we're going to discuss the alternatives to dental amalgam restorations. Now, being in private practice myself for well over 10 years, there have been many advances in restorations that patients regard as the white fillings or the resin restorations. Interestingly enough, amalgams was introduced into dental practices since the 1830s. Dental composite restorations were introduced into dental practices as late as the 1960s. So composite resin restorations, when it first came out in the market, was a fairly new form of restorative material. But as time progressed, advances in technology had influenced also the advances in dental technology and materials, And we now are finding restorative materials that are more aesthetic, less destructive, and on the benefit part of the patients, a little bit more economical as well. I found quite a few composite resin restorations that would match up economically with an amalgam, as well as regarding the characteristics of an amalgam restoration. Sometimes far giving you a far better result than we would find with an amalgam restoration. I would like to know, Dr. Moodley, at the training institute levels, what alternatives are now being taught to the upcoming dental professionals, our future dental professionals?
Okay, I can speak for our university. We don't do any the silver fillings on pregnant patients and children. We're mostly using it in the lab when it comes to making choices for patients. Together with patients, a decision is made, and most of the time it is an aesthetic material that is chosen. Patients want a filling or a restoration that looks like their own teeth. And fortunately or unfortunately, composites is the material of choice. So not so long ago, a study was conducted in KZN as well, and most dentists have phased out amalgams from their practice, and they are using the tooth-colored materials. So there is a place for the tooth-colored material because of aesthetics. And like you're saying, there is new materials that are reinforced with fiber, new composites that are strong, that almost replace amalgam. And what is nice is these materials bond to the tooth surface. So it basically sticks to the tooth surface, unlike amalgams, which don't bond to the tooth surface, and you have to cut a specially designed prep for amalgams, which is not good because sometimes you have to cut a large prep just to accommodate the material. With composites, however, you can cut a tiny prep, a little prep, a shallow prep, and the material is good enough to work in that prep. So that is a huge advantage with composites because you can cut little preps and restore them with ease. The material doesn't indicate the design of the prep. I hope that helps.
Most certainly, Dr. Murli. I think you've taken the topic home now, where we can now see the big difference between dental amalgam restorations and the alternatives, which is vastly the composite resin restorations that come with a variety of options, a variety types of composite resin restorations, being your microhybrid composite resin restorations, fiber reinforced, and now we even have zirconia reinforced resin restorations. And I think this afternoon we've summed up quite a bit regarding dental amalgam restorations. I'm quite sure that during this lunch hour it was informative enough for the public out there to make a more informed decision regarding what form of restoration they would like to have on their teeth. And also, I hope bulk of the public has listened to the one little aspect that Dr. Moody mentioned, where try your very best not to need a filling and take good
Absolutely.
care of that oral cavity that you were gifted with, because your smile is a window to your soul. Am I correct, Dr. Moodley?
Absolutely. We should be taking care of our teeth because we have a lifetime to be healthy. Without our teeth, we can't eat. And, if we have a good oral cavity, good gums, good teeth, we can live longer. We can prevent lots of other conditions. And I think that's going to be another webinar soon. So the link between your oral health and your general health. So take care of your teeth. That's all I have to say to the public.
Thank you, Dr. Moodley. I'm just going through to see if we have any questions for this afternoon. Right. there doesn't seem to be any questions, so I think we have managed to fulfill everyone's need regarding the information they require with dental amalgam restorations. And I think we added a little bit more over there regarding the alternative restorative options as well. So I wish you all, the viewers that have attended this afternoon, a big thank you for being in attendance. A big thank you to you, Dr. Moodley, for the valuable information that you've imparted to the public at large. And of course, a big thank you to the South African Dental Association for this public oral health awareness campaign. So thank you to the South African Dental Association as well. And I bid you all a very well and blessed midweek, or how we say in KZN, a happy hump day. Thank you, everyone, and good
Thank
afternoon.
you.